Hello. For those of you that don't remember me, I'm Dr. David DeSha. I teach in the Department of Anatomy. Just wanted to update you, our alumni across the country, about what's going on here at the institution. We're very proud of what is happening here at the institution. This pandemic has caused such upheaval in our lives. I can only imagine what you're seeing and feeling where you are. And we just wanted to let you know that we're extremely proud of what you're doing in your communities across the country. We've heard some really interesting reports from alumni about what they're accomplishing, and I'm so proud to be a part of the training here at this institution that relates to all the medical students we've turned out over the years. The medical school mobilized early in this pandemic, and they shut down all the buildings. Essentially, we have to enter through the hospital side if we're going to enter at all, and we have to go through hand washing, temperature check, and all of that. We're now working online. All of our classes are online. It's sort of difficult to teach neuroanatomy lab online, in my opinion, as an anatomist, because the students don't get to touch and feel the specimens, but we certainly are making do in that regard. Unfortunately, we had to cancel our white coat ceremony for the sophomores, and we had to cancel our senior match day and graduation. And it just is so sad for all the students that we had to cancel those events. It's sad for me too, because I enjoyed so much participating in that with the students. We also had to postpone our reunions for the 40-year and 45-year class. That's now scheduled for the end of October. On the brighter side, LSU Health is responding to this crisis in a variety of ways, but three things that I'm going to talk about with you to let you know what's happening. They've established a lab here that can test for the virus. It's called the Emerging Viral Threat Lab, and it can process about 1,000 samples per day, I'm told. And not only that, they can sample for mutant viruses, which is of interest in the community. Beyond that, we have a convalescent plasma program. And that convalescent plasma program, it's getting plasma donors from individuals that have survived the virus and survived the disease. They donate their plasma, and hopefully they've generated antibodies that can be infused in our very sick patients. Lastly, we are in a clinical trial with institutes from across the country and infusing our inhalant nitric oxide therapy. And we have at least one patient that is on that therapy now in our institution. As for me and my wife, we are practicing all the protocols for distancing and staying at home. Unfortunately, I'm classified as a non-essential person right now, and being 76 years old, I can't participate in everything that's going on in the response to this virus, but we are taking the opportunity to get outside. My garden is the best it's ever been in years, and so we're enjoying that thoroughly. The thing that I'm looking forward to ultimately is getting back to teaching, which I love, and hopefully I can interact with this class. It's my 50th class that I'm teaching, and hopefully it won't end up all being online. Anyway, we hope to see you at some point in the future, and after we can talk about this event that we're having in the past tense. We want you to know that you can contact us at the Alumni Association at any time, and we hope that we can help with whatever your needs might be. I guess that's about it. Take care of yourselves. So long.